Okay, hi, my name is Thúy and I'm a student nurse. Is that okay if I follow you around today?
It is. My name's Jackie. I'll be the nurse on the floor today.
Can you give me the EXPO report on the patient?
Sure. With us, we have Shanana O'Connor. She's 34 years old, and she's currently assigned to room 231. She has allergies, the trimethoprim, sulfamoxazole, and she's also a full code. She was admitted today for end-stage renal failure, and she's also a diabetic type 1, and she presented today to the hospital with fevers and chills, and looks like general malaise. She reports increased blood glucose and decreased appetite the past week. During her pain assessment, she reported pain 4 out of 10 for her pain scale. She has numbness and tingling in her legs, but she does, however, have full range of motion. As far as her vitals goes, her temperature last taken was 101, heart rate was 95, O2 sat 96, and her blood pressure overall was 138/78, with her respirations at 20. And she currently has Perla. Her, as far as lung sounds go, they were clear in all lobes. She does have a bit of a productive cough with clear secretion, so we're trying to keep our eye on that. And heart sounds were regular with S1 and S2 heard. I didn't hear any murmurs, so I was pleased with that. And again, back to her lower extremities, she does have a slight edema in the lower extremities, and her cap refill was greater than 4. When I did the abdominal assessment, all 4 quadrants were hyperactive, and all of her abdominal quadrants were tender.
Okay, so why is this client receiving this medication?
She has a suspected bacterial infection, so we're going to look at getting that under control.
Okay, and what action does the medication have on the patient?
The medication actually is going to bind to her bacterial walls, and overall that's going to result in cell death.
Okay, and when should you question administering this medication?
If the client were allergic to the medication, I would, or she had any previous negative side effects to it, we wouldn't want to give it to her.
Okay, does the medication have a therapeutic serum level?
It does not.
Which vital sign must be monitored?
You're going to want to monitor all vital signs, but specifically you're going to want to look at her current temperature, her heart rate, her respirations, and especially her blood pressure. Because if any of that were out of norm, you'd want to think twice before administering the meds.
Okay. And which physiological parameter should be monitored when the medication is being administered?
The physical, I'm sorry, say that one more time?
The physiological parameters should be monitored.
You'd infiltration around the IV site, you would want to look for any discharge, anything of that nature. Also, if the IV wasn't properly intact and flushing.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You'd want to teach the patient the signs and symptoms of the side effects of the medication, as well as anaphylactic reaction.
Okay. And what are the side effects and potential adverse reactions?
There can be dizziness is very common, hypotension as well, your common diarrhea, nausea, vomiting, rash, sweating, and possibly sometimes hives.
Okay. How will you know the medication is effective?
You will know it's effective when the patient no longer presents signs of infection.
Okay, that's all the questions I have right now.
Okay, well let's go ahead and I'm gonna meet with the patient.
Okay.
Okay. Just follow me in. Okay. Knock knock. How we doing today?
Okay.
Just okay?
Yeah.
That sanitizer in the hallway wasn't good enough. So, just okay. Do you have any negative symptoms at all?
I feel sometimes it's hot and sometimes it's cold.
Okay. So you're having hot flashes a little bit?
Yeah.
Okay. Well, your blood pressure was a little bit high, so we're going to look at giving you, doctor ordered some normal saline as well as an antibiotic. So my name is Jackie. I'm going to be your nurse today, and this is also Tui. She's a student nurse, level 2 at St. Petersburg College, and she's going to be in the room with us as well.
Okay.
Okay? All right. Can I start by having you verify your name, please, and age?
It's Shanana O'Connor. I'm 34 years old.
Okay, and can you verify if you have any allergies?
I have a trimethoprim sulfamethoxazole.
Okay, all right then. Okay. Well, I'm gonna go ahead and start up your medications and get your IV line going for you. Do you have any concerns you want to bring up with me at all?
Not right now.
Not right now?
Yeah.
Okay, well, one thing I do want to talk about before I hang your IV line, as far as your medication goes, are you familiar with the side effects of a superinfection at all?
Oh no. What is that?
The superinfection? Basically, it's when your body balances out, attacks both of your good and your bad cells, and is not able to balance itself out in simple terms. So the side effects with that are going to be like a black, tarry type tongue, loose stool, foul smelling stool, and also, let's see here. You may, I wanted to triple check that for you. You may experience actually some vaginal discharge or irritation or itching as well. So basically, I want you to just be aware of those signs and symptoms, and if you start to experience any at any time, go ahead and just ring your call bell, and I'll come in and assess you.
Okay.
Okay?
Yes.
All right. So I'm going to go ahead and check out your medications, bring those up in the system, just verify the order, and we'll get you started. Okay, so we want to come up, and I'm going to first start by, before I want to flush her IV site out, but before I actually flush, I want to verify she's getting the correct medications in the system.
Okay.
All right. All right, so first we have the Impinemin, the sodium chloride as well. Okay, so you want to do your first med check. So I want to verify correct patient, which we have the correct patient here, correct age, 34 years old, and the same allergies. So that lines up. So it looks like the sodium chloride here, let's go down just a bit. Okay, so sodium chloride 0.9%. Stop on Sunday, so the time's correct, lines up. The rate looks like it's going to be 30 milliliters per hour, continuous, so this is going to be your primary line.
Okay.
And let's see, dosage time is also correct. 07:47. Okay, so the time, everything lines up with that. I want to check the bag for any tampering. Make sure there's no loose particles hanging around inside or any cracks around the valves, and ensure it's safe to deliver. So this is good. And then the actual medication, again, want to line up correct name, age of the patient, the allergies. Want to verify the medication name, so I'm pinning. This is the same. Time is the same. Dosage looks like, let's see, 500 milligrams of that. This is actually going to be your IV piggyback.
Okay.
So obviously both given through the IV, and it looks like this every 8 hours, but it looks like we're going to run the 100 millimeters per in 1 hour.
Okay.
All right. And then again, I want to check for any tampering in the bag. Everything looks good, no loose particles. And one thing I forgot to mention is the expiration dates on both. You want to check. So the medication bag is good, as well as the, let's see, the date. The Slims bag is good too. All right. So we did our first medication check. So I'm going to go ahead and talk to the patient again, and I want to do a IV flush before I actually start running the lines and everything. If there's an issue with her actual IV site, we're going to have to do something about that, either redo it or figure out what the blockage is from.
Okay.
Okay. All right. Coming back in the room then. How you doing, Miss O'Connor? Back to see you. I have your medication for you.
Okay.
All right. Before I start, I want to flush that IV and make sure you're good to go with that site. But before I do that, can I get you to verify your name and age, please?
Shanana on Connor. O'Connor. Okay, and then I'm 34 years old.
Okay. And do you have any allergies?
Yes, trimethoprim, sulfamethoxazole.
Okay. All right. So everything is good with that. I'm gonna go ahead and flush your IV real quick.
Okay.
Okay. 1 second. Okay. So I want to look for any type of leakage before I even do this. Flush it out. Everything looks good. See nothing there. So since this was kind of out in the open with the bedding and everything, I want to go ahead and scrub the hub of the IV site. Okay. All right, good. Everything looks good. Close that back up. Okay. So I'm gonna go ahead and do my second medication check.
Okay.
All right. So again, I'm gonna hang this is gonna be the primary bag, so I'm gonna go ahead and hang this first, but I'm gonna do both checks now.
Okay.
All right. All right. So again, got the sodium chloride on order. Looks like the order start date is correct. Time, rate 330 milliliters per hour. Obviously IV is the route, and frequency continuous. And we are right on time for the dosage time. And then the actual medication, I'm gonna verify the name, and then IV injection, start time is correct, stop time, dosage, 500 milliliters, IV piggyback every 8 hours. And again, we want to ensure that you have the correct patient as well with the medication. So we have Miss Shanana O'Connor, 34 years old, and allergies are still intact. All right. So
Before I leave,
I'm gonna go ahead and hang her her primary line first. So now this is a dial flow.
Okay.
So what I'm gonna do, her primary bag, I'm actually, let's see, we're ordered at 30 milliliters per hour for the initial bag, right? So the dial flow is connected. Originally I'm gonna set that at the 30 milliliters per
Okay.
hour for the dial flow. However, when I hang the medication, we're gonna switch that up to the 100 milliliters per hour.
Okay.
And then what I'm gonna have to do is come back at exactly an hour, and I wanna switch the dial flow back over to the 30 milliliters per hour to the primary line.
Okay.
So it's not running at the wrong rate.
Okay. That's good to know.
Yes. You can see where that'd go bad real quick. Okay. So, with that said, we're gonna go ahead and basically bleed the line out and prime the line.
Okay.
So I'm gonna go ahead and
and all I'm gonna make is,
make sure that the dial flow is open as well,
Okay.
because it doesn't make sense to prime one and not the other.
Okay.
All right. So that's open. Make sure this is closed.
niacin, MEQ, and 250 saline.
Okay. We're in good shape. And at no time should your
IV,
IV line hit the floor, so just be mindful of that when you're hanging your bags. Sanitation issues. Okay. This looks good. So
okay, and initials.
I'm gonna go ahead and spike the bag.
Okay.
All right, any questions?
Okay. So take the cap off the fresh saline bag. Cap off the
Oh,
spike.
yeah, well, we wanna just make sure, of course, that we have the 5 rights. It's the right person, right route, right time.
And a lot of times you're gonna feel like you're popping the bag, but really you're not doing any harm. And if you were to pop it, just get you
No,
another
that
bag.
Okay.
was the,
Alright.
his labs had changed, and he no longer
So-
showed infection. I might check with the primary care provider.
Did you get information, like how you administer the medication?
This is, ordered to be IV.
Actually,
so
let's
it's
stay on
over
this.
Okay, thank you so
Just
much.
gonna use regular for now.
Try again.
Alright, thank you.
It's ready. So, like I was saying, you want to go ahead and prime the IV line.
Well, it is, it's just I don't want to forget anything, I don't care.
Over the garbage works fine. I'm gonna do this over here.
Hey, you were doing a freaking rip.
Oh, no, that's just because I was going like that. I wanted to get another first time.
Okay.
And they get coming in, because the other class is coming in now.
Okay.
So,
Oh, yeah.
don't get that.
Alright. So we need to, like,
Okay. So this is good. Next, what I'm gonna do is lime's all primed out. Same major.
okay, awesome. Yep. Let me save this, get out of here.
There we go. Seen a few bubbles in there. I wanted to get rid of.
Okay.
All right. So keep this wound up, and we are going to be connecting this directly to the primary IV site. So I'm going to clean this off again, and we've already properly flushed this, so we know that this is operational, and she's not going to have any complications. So go ahead and connect this. Connecting the ports. Clamp is off. Everything's opened up over here, and again, I don't see any leaks or any signs of infiltration, so that's a plus. And I'm going to, as I said, set this dial flow to 30 millimeters per hour. For now, since the primary line, we'll switch up the medication later, or next, not later. Okay. Okay. Those open up and running. And rule of thumb is to stick around. You want to see this drip at least 5 times to ensure that the medication and everything is set up correctly.
Okay.
So, I got 1, 2, 4.
No. Oh, yeah. Yeah, all this,
Okay.
all this stuff goes in this bag, and it's everything you need to do that.
There first?
Yeah, let's do it on here.
Alright, so then next, what I'm going to do is I'm going to hang the actual piggyback medication. So we're going to do the other check on the medication before I hang it. So we're going to check one more time. Correct patient, age is correct, allergies line up, and we have the correct medication here for the, let's see, and then dose is the same, 500 milliliters. Route IV piggyback every 8 hours time is good, and the patient, alright. So, let's see.
Oh yeah.
do is do a little bit more documentation.
Mhm.
See here. Okay. Alright, and so what I was doing here is I was just inputting the medication information. So on the first one when I inputted it, I had the green light, so it verified through the system that it was safe to give the medication. And then I just did the same thing for the second medication.
Okay.
Inputted the information in the system and the patient ID, and it gave me the green light for administration, so this is now safe to give.
Okay.
Alright. Alright, Mrs. O'Connor, if I can just have you verify your name, please, and date of birth, or excuse me, age one more time, please.
Shanana O'Connor, and I'm 34 years old.
Okay, and what is your allergies, if any?
Trimethoprim, sulfas, methoxazole.
Okay. Alright, so I'm gonna go back here to the computer. I'm gonna verify that information, same name, age, and the allergies. So we already have the green light to go for
Okay.
the safety purposes for the medicine. So. So same thing with this. I'm gonna go ahead and spike the bag.
Okay.
And then you're also going to prime the line real quick. Alright.
Almost done.
Okay. So you want to scrub this port up here. And you want to ensure that the line is closed.
Sorry. Okay.
Okay? So everything's good on this end. So I'm going to scrub this. I'm going to go ahead and connect. And you're going to keep your medication bag higher as well. I'm going to lower this. Let's go ahead and lower your primary bag. Okay. And then remember we talked about the dial flow as well?
Mhm.
So you're going to want to change this to, we're running this at 100 milliliters per hour. So what I'm going to do now is change the dial flow to 100 milliliters per hour, and that's set. So let me set, so the time, I'm going to come back, so rate in exactly an hour, and I'm gonna switch the dial flow time back to the 30 milliliters per hour.
Mhm.
And so the medication bag should have ran out by that time, and we need to switch back to the original 30 milliliters per hour for the rate.
Okay.
And let's see, 5 drips going on this. So go ahead and open this up. Alright. Let's see any leakage. Good. And check IV site again, just as a precaution. I like to do that to make sure there's no swelling in the veins or infiltration or leaking, and everything looks good and everything's open, flowing good. How are you feeling, Miss O'Connor?
Yeah, I'm feeling okay.
You feeling okay? Okay, can you remember we talked about infection? I discussed super infection with you earlier.
So you say like black, furry tongue.
Yeah. Can you
And-
name off a few more symptoms?
So vaginal irritation, discharge.
Yep. Or discharge, possibly.
Loose stool.
Yes. Yep, loose stool. So if you start experiencing any of those types of symptoms,
Mhm.
go ahead and ring your call light, and I want to come in and assess you. I just want to make sure you're not having a negative reaction to the medicine or an allergic reaction that we didn't, you may not know that you have.
Okay.
All right. And I also printed off, I know you're able to verbalize a few of those symptoms to me, but I printed off some reading material for you as well about super infections
Okay.
and what to expect with them. So if you want to watch, or read this in between your shows, you are more than welcome to. So, your call light is right here. Let me lower your bed down. Safe range. And is there anything else I can get for you in the meantime?
Oh no, I'm good.
You good to go?
Yes,
Okay. Just
thank
like I
you.
said, if you need anything, just ring that call light and I'll come in.
Okay.
All right, thank you. All right. So at this point, let me go ahead. See for the documentation. Just have some further documentation to finish up.
I have a few more questions. Do you mind if I ask them?
Sure. Let me wash my hands first, real quick.
Okay. Okay, so were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, vital signs. I want to make sure, the blood pressure is at a safe range, heart rate was at a safe range, the O2 sat, as well as the respirations. If those were high or super abnormal, we would wanted to have questioned the medication administration.
Yeah, so did this information affect your decision to administer the medication?
In a sense it did, because once I monitored her baseline blood pressure levels and vitals, I knew that I was able to safely give her the medication.
Okay, and did this information affect how you administer the medication?
It didn't affect how I administered it. I, of course, verified with the system the milliliters per hour, so the dose for each medication. So that was really the only thing with resetting the dial flow.
Okay.
All right.
Okay. Yeah,
Any
that's
more
all
questions?
the questions I have. Yeah, no, thank
Okay.
you.
Do you want to go see some more patients?
Yes.
Okay.
Okay.
All right. Let's take off.